provider
The broadcast is
collaboration. I
now
mean,
starting.
this is,
All attendees are in listen-only mode.
really, really great that we're all coming together for the first time and not doing virtual for everybody, but we know we've got some folks on the line, and I wish everybody happy holidays, happy new year. Spend some time with your family, get some rest, because when we start moving in January with the next round of implementation for LTSS, from what we've learned in the past, we'll be rocking and rolling again. So again, I think that everything's great, that what you've been doing in the past, what we've learned. I think that our panels today will be exciting. One of the things that we have to do is continue to look at where we are with also not just moving into LTSS, but we were very responsive to individuals and families. If you recall back, and many of you have been here for a period of time with the DDA, looking at our waivers, and we had about 22, 23 waiver definitions at one point in time. We're up to about 55 right now, 56, somewhere through there. And, if you look at employment, then there's subsections within employment. I can recall when I started here and I asked the first question, and I said, how many people have a job? And they said, well, you can look at the number of people who are in the employment services, but that's not going to give you a real number. And I said, well, why not? And they said, because that's how we pay the providers for people who are doing volunteer work. Well, volunteer work isn't employment. It's meaningful to people, but it's not employment. So obviously we had to get, better at what we were doing. One of the issues that we have with PCIS2 is we've been paying providers to provide supports to people through day-hab, et cetera. And we know what the regulations say about you got a X amount of 4 hours to bill for a full day and all the rest of this stuff. We know it was relaxed during the Appendix K with the public health emergency. But, we need to start taking a look at, and one of the panels today will be dealing with this, about what does it look like when somebody gets into the community? Because we know it's around the corner, coming March 17th, 2023, and looking at the community settings rule, which CMS put out back in March of 2014, with a 5-year glide path for people to put in place. And then it was relaxed during the public health emergency, but also prior to the public health emergency, it was relaxed, and they moved it out another year because many states were not as well positioned as we are in this state. And they relied heavily on congregate type settings and said that they could not move their system that fast, that quickly. And so as we move forward, one of the things we have with the community settings rule is people being out in the community. And that's where we have about 55, 56 areas that we can look at. So if somebody goes out and does, some type of community engagement, then we need to say, okay, they're doing that for an hour, and then the next hour they might be doing something different, and then they might be doing volunteer work and then personal supports. So all of this stuff is about grading, stacking, blending the services to meet somebody so that they have a real good life. So, I think that as we continue to move forward with this, I'm excited that we have the two panels. And today with us, we have Karen Lee, who is the Chief Executive Officer of SEEK in the Southern region, and John Butterworth, many of you know from the Institute of Community Inclusion, because you participate twice a year in the wage surveys and who's working, and they put all that data together for us. So, I think that that's really important that we have all of these partnerships and we continue to move forward with this. So as we know, there's another panel that's going to be dealing with person-centered planning, and we know that that's extremely important because that's what we're about. We're about people having a great life, people having control of their own life, and making sure that we support that. We meaning DDA, families, providers, case management, everybody's in this together. And we need to look at this and continue to perform and then say, are we doing the best we can? Can we get better? How do we do this? How do we refine this? Again, I'll go back and use the example of the waiver definitions that we had, and we had to be responsive because people said, that's not what I want. I want something a little bit different. And we listened and we developed. And then we said, okay, did we get it right? Is this meeting your needs? And if we didn't, then we go back to the drawing table. You never finish. In my opinion, you never finish because you can always get better. And you always got to go back and say, well, we didn't cross the finish line and we're done and we're not going to refine anything. We're not going to, this is it. It's in concrete. That's not the way it works. So we need to think about this, about how we do and be reflective and continue to move forward and use like the life course, right? Everybody familiar with the life course? Yeah, and the integrated STAR? Great. And so we need to continue to look at that with life domains and the way we continue to do this. So, with that, I think we're going to bring up the first panel. Yeah? Okay. So I think I'm done. You don't need to listen to me. You need to listen to the panel and about what their experiences was. We're fortunate that Karen Lee did agree to say, yeah, I'll come up, I'll do on the panel because, she was an early adopter. Her agency went in, we did the first year, we did the transition from PCIS2 to LTSS. We did 3 providers in July. We did 2 more in October. And what were the lessons learned? And it was about stacking and braiding and training your staff. They're out in the community. They're doing different services at different times. There's different codes that need to be done, that need to be submitted into LTSS. So with that, I want to turn this over to Nick, and I assume you are going to do the introduction. So thank you. And I'm glad you're here, virtual and in person.
Thanks, Bernie. So for the first panel, those of you that were the panelists for the first panel, do you guys want to come up? And then we will do some introductions. And before we do introductions, I'll just do a little bit of housekeeping so that everyone kind of knows what the day is going to look like. We did. The panel decided to go all black. It really was planned. So today is going to look and feel a little bit different than I think most of our webinars or our engagements have. For one, we're in person. 2, we're doing a panel. I promise you, nobody's going to stand at a podium and speak to you for an hour or 2 hours. Won't happen. The group here, the people that are doing the work every day, like each one of you, are going to be the ones engaging in conversation topics that all of you said are important and want more information on. Rhonda and I are going to help facilitate the conversation today, but this is the group of people that's leading it. We're also going to be working with Dr. Smalls to make sure that she moves us through the slideshow so that it stays pace with the people that are watching online so that they can hear the conversation based on what the panel members are saying. So I think what we're going to do is we're going to get started with the panel members going ahead and introducing themselves. And I think you all have a mic up at the table and just pass it down the table and then we'll get started.
Okay, my name is Onesta Duke, and I am the Regional Director for the DDA Southern Maryland Regional Office.
Good morning, I'm Stacy Herman. I'm the Assistant Vice President of Neurodiversity and Community Workforce Development at Kennedy Krieger Institute, and I oversee our provider agency.
Good morning, everybody. I'm Sean Cross, and I'm the CEO at the ARC Northern Chesapeake region.
Good morning, everyone. My name is Alexa Ennis. I'm the Program Director of Case Management with Optimal Healthcare.
Hi, I'm Kathy Marshall. I'm the Western Maryland Regional Director.
Hi, good morning. I'm Jamie Stoner, the Senior Vice President of CCS Services with Service Coordination.
Good morning, everyone. My name is Alan Sheehan. I'm the Chief Programs Officer for Abilities Network, and I oversee our DDA Services program.
Thanks, everyone. Welcome to the panel. I'm super excited that you guys all agreed to participate in the panel. If we want to go to the agenda slide so that we can make sure we talk about what's going on today. I think it's the slide back in terms of the agenda. All right, well, we're going to talk about person-centered planning today mainly. Part of that is going to be the roles and responsibilities in person-centered planning. And then we're also going to talk about some of the flexibilities around person-centered planning. Bernie had talked a little bit about that. And we're going to engage in a conversation, not just flexibilities around meaningful day services, but flexibilities also as it relates to personal supports, flexibilities as it relates to people's general lives and the lives that they want to lead in the community and the relationships that they want to build. We're also going to share with you some updates that we're making to the person-centered planning, development, and authorization guidelines that I think are going to spell out a lot of what this group is going to talk about today in regards to person-centered planning flexibilities. But first, we're going to start with roles and responsibilities. So this question is for all of you. So we're all together, right? You all represent CCS, region, agencies, and I think to start us off, I want to identify the elephant in the room, right? Sometimes the person-centered planning process can have some challenges. And I want to hear from your role and your perspective what some of those challenges are, and then save what you're doing to work through those with your partners for a follow-up question. So, Alan, did you have the mic? Did you want to start us off?
Ooh.
All right, thanks.
So to clarify, are you looking for challenges with the PCP process or roles and responsibilities?
Roles and responsibilities as you're engaging in the PCP process.
Okay. All right. Gotcha. Okay. So at Abilities Network, we provide direct support services. We're all community-based. So our primary role and responsibility is, one, to get to know the person, use that information to help support steps to help them achieve their outcome description. So that's our role from a provider standpoint in the PCP development. My role, I don't provide direct services, but as a provider, one of the things that we spend a lot of time doing is working with our CCS and DDA partners and providers, other providers, to collaborate on strategies they're using to make the process as efficient as possible and as person-centered as possible. So we have the role in the field, but you can't separate that from the role of collaborating with others.
And so from the CCS perspective, the CCS obviously is the person who is supporting individuals in developing their plan and advocating for the lives that they want, looking for resources, maybe funded by DDA or not, right? Using community resources, family, natural supports, pulling that all together and really facilitating conversations with everyone involved around what needs to happen for the person to achieve their outcomes and goals. So that's kind of the broad overview, and then you get into the details of coordinating team meetings and making sure that not only the person supported, but the providers, family members, other stakeholders understand what their role is in what the person is asking for in terms of supports. And then collaborating on needed documentation to include within the plan. So things like nursing care plans, behavior support plans, cost details, DSTATs, all the wonderful pieces of information that we gather from our provider partners. So we will collect all of that. We enter into the system. And really it's the role of facilitation and collaboration to help that person's vision come to life.
As the regional director, we are responsible for ensuring that the plans are reviewed and hopefully authorized within the 20 days from the time of submission to the regional office. We also, as regional directors, review 100% of one-on-one requests and two-on-one requests, as well as 10% of all the PCPs that come in. Many times we're asked to consult either by our own team, a CCS agency or provider agency, because we see needs or somebody's path to a meaningful life, and we don't really know if we've got all that down on paper. Not wanting a service life, but wanting a life that is meaningful and going the path someone wants. So we work very closely with CCS agencies and providers and our own staff and families and individuals, because sometimes we don't always know what is written on that paper is what the person wants. And many times just a phone call to a person or a family will clear that up immediately.
At Optimal Healthcare, we try to keep our CCSs most informed, and that really helps us execute our roles effectively. Really what we have to focus on is getting to know the person, collecting all the necessary information for the PCP, but most importantly, being informed of what the DDA waiver includes, how these services are defined, and related to what Kathy shared, that it accurately displays this person and their trajectory of life on paper. Some challenges that we face are having correct documents, having documents in a timely manner, because we do have to submit the PCPs within 20 days of the annual PCP date. But to mitigate this challenge, we have been tracking all PCP courses within 90 days. We create the plan. By 60 days, we schedule or complete the meeting, and we strive to submit the plan to DDA within 30 days. All the while making sure everything in the plan is accurate and within DDA waiver standards.
All right, Nick, so do we do challenges? Or, because I mean, roles and responsibilities, because I feel like, Alan, you kind of described that as a provider. So we're a provider. And I think our biggest thing that we pay attention to is making sure that the plans are person-centered, that information is coming from the table. One of the challenges I think we all have is making sure the people who really know the person is at that meeting. And so sometimes our case managers don't know the person as well as the direct support professional who's with them, as well as the CCS and all of that. So making sure that that happens. But making sure also that internally everybody knows roles and responsibilities in regards to that. And when there are challenges, I tend to only get involved when there are challenges though, right? It's like, Sean, this isn't working. Can you reach out to? So that's the role I play, but it's around that collaborative nature. And so I think that's we believe at the ARC that you have to be collaborative and try to solve the problem versus make a bigger problem.
I can definitely relate to being brought in when there are challenges at Kennedy Krieger with our programming. But one of the things that's really resonating with everyone who's spoken before me is the number of people that are participating in this meeting and potentially, and I see some head nods going on here, trying to get that group of people together in the meeting timeline, ensuring that the person is able to express their needs and wants with all of those people in the room who also are advocating for them and believe that they are their advocates as well. So we find that to be a huge challenge to ensure that we're making sure the person has their voice throughout the meeting and it's not everyone else's voice, but then also just scheduling the meeting and getting the group together. The other piece that we really find to be sometimes challenging is that documentation, especially when there is multiple agencies within that PCP meeting or supporting that person. We are sometimes waiting for one agency to complete the paperwork, to get the documentation in, and then our CCSs, who we work so closely with, are then waiting on that. I know we're not talking about solutions, but when we do at Core Foundations at Kennedy Krieger, we've come up with some really great solutions to ensure our documentation is completed and provided to the CCS actually prior to the annual meeting. And then I also think the other challenge is ensuring that people are talking. I know I mentioned this before, but talking to the person in the meeting and asking questions to the person being served. We often in that meeting people are speaking to all the team members and not the actual person who was receiving services. So it is so important that that person is the forefront of that meeting. Again, when we have solutions, we've also implemented solutions to support that.
Thank you. And just to add to what Kathy stated in reference to the regional office and our role, in addition to reviewing and authorizing the person-centered plans, we also provide a lot of technical assistance in clarifying our waiver regulations, our policies, and any guidelines that are developed by the DDA. In reference to challenges, I would say some challenges that we experience relates to timely submission of the person-centered plans, and some issues that may arise with documentations being uploaded into the person-centered plans, and making sure that the team are all on one accord as it relates to the person's needs and services and so on and so forth. But typically we try to work through those challenges by reaching out to the provider, to the CCSs. Our provider services team work very closely with providers in order to obtain needed documentation. And we also rely on our CCS squad to also assist us with connecting with CCSs to get needed information as well.
Thanks, Onesta. So you stole my follow-up question to you, Stacy, but I'm still going to come back to you, but I'm going to go to the CCS first. So Jamie, Alexa, when you guys are supporting the person, right, who's the driver of this person-centered planning process, and you encounter challenges that each of you just said that happens, they pop up. There's a lot of people participating, there's a lot of paperwork. What are you and your agency doing to help facilitate that with providers, with the region? Jamie, specifically, I know your agency has started you have a fun acronym for it, but I'm not going to steal it. I'll let you share it. But what are you doing around that, and has it been successful for your agency?
Yeah, I think when we talk about challenges, everywhere from scheduling to the amount of service definitions that we're all learning and adjusting to, there's going to be hiccups, right? There's going to be misunderstandings. There's going to be questions over timelines and maybe disagreement over what's included in the plan. Nick was referring to one of the challenges is around timely submission of plans, right? That's one of the things that we need at that 30, 20-day mark to get DDA the plan so that they can do their piece and review it. And it's really easy to say, oh, we're waiting on the provider to give us the cost details so we can't submit the plan. That's what's holding it up. And I think we're really trying to be solution-based because it's not just a plan. That is connected to a person and their services and the ability for them to receive those services. And so we can't just sit and say, oh, we're waiting. So we, I guess in this industry, we use acronyms a lot. So we came up with the FAST initiative, which really is just our attempt to communicate with providers on a weekly basis of plans that are coming due or are approaching the point that need to be submitted, and we're still waiting on something. You ask how it's received. Feedback from the region has been that it's been really helpful for them to support us. Sometimes there's education. There might be collaboration with the CCS squad or the regional offices directly to the provider to talk through what support they need. And then, data changes minute to minute in LTSS. So one of the pieces of feedback that we've gotten specifically from providers is by the time you get that, some of those plans may have been submitted. And so it could feel like a futile exercise to be looking at this spreadsheet, and it's something that we continue to tweak and work on. But it's our approach to collaborate and make sure we're on the same page. And we started communicating with providers well before providing a list to DDA of the plans that we're waiting on from providers, because we want to be transparent, we want to be solution-based and figure it out together so that we get the person what they need and we get it to DDA on time.
Thanks, Jamie. That was a great answer. As you can see, I'm going to say some similarities because communication with the providers and all of the team members that should be there to advocate for this person is one of the biggest challenges that we get feedback on as far as CCS agencies. Along with communicating with providers in a proactive way, we really rely on them to give us data that shows the need. We trust their feedback on what's working and what's not working. But if we also find an issue with receiving documentation, we offer how can we assist. Our agency has offered to connect certain providers with the DDA. We've even facilitated sharing DDA resources with providers to help them feel more confident with completing their paperwork. But most importantly, we make them feel that this is a collaborative effort. As we've all said up here, there are plenty of challenges that we all face, and solving a problem does not mean making the problem bigger, right? So how we do that is to communicate. Like Jamie said, communicating ahead of time, at least 90 days, really helps give everybody enough time to be as proactive and as involved as they should be. Some teams can have up to 20 people if that's who this person wants planning the trajectory of their life. And that can cause a lot of legwork for us to get them all at the table. And that's one of the biggest pieces that we have to focus on. So that way we're reflecting who this person is accurately.
I just want to say I appreciate being able to collaborate with the CCSs because our team does meet with our local CCS group once a month and it's been great. We've been doing it for years actually to kind of figure out what are the problems, how can we solve them locally, and then being able to, collaborate with DDA and we get ahead of the problem instead of behind it. So it's been great.
When you're talking about communication, which I think is so key, and especially because so much of things have gone digital and we're emailing, and you mentioned the 90 days and, pre-pandemic, if we can remember that time, there wasn't a lot of those timelines put in, and you guys have put in those timelines. And I think what's important is that teams in this time may have developed their own processes, which is something we've definitely done at Kennedy Krieger Institute. And within that process, we still get everything within the 90 days and we get it done. But sometimes when we collaborate with our partners at CCS, they're very set on we have to have a meeting 90 days before. But I think it's remembering the flexibility of the team. It's ensuring it still gets in that 20 to 30 days ahead of time. But we have flexibility to work together if we've developed a team process. And I also, talking about introduction of new team members, that's another great way to communicate with your CCS partners. We send an email and introduce any new team member that has come on in our manager, our coordinators, to all of our CCS partners, all of our state partners, so they're aware of our new team members. And we provide all of our CCSs are included on our family communication of the first of the month. So they're getting a brief update on a monthly basis as well. Should I continue with solutions or you have a question?
The question for you you've shared with me a lot of what your agency does during that pre-planning process to support the overall person-centered planning process. And I wanted you to share what your agency's doing because it sounds like it's been pretty successful.
Yeah, we have some CCSs we've been working with for years, really part of our process. And early on, we decided the person has to be first, which I think we all agree in this room that is the most important, the person receiving the services. So we created an internal person-centered plan that happens prior to the scheduled meeting. So when our CCS partner reaches out and says we need to schedule our annual, it triggers an internal process within our team built within our cloud-based online data system. And ultimately, it triggers what we call the internal PCP, which our direct support professional works directly with the person we serve, which we call community member, to update their plan. It reflects very much the state person-centered plan, but it provides the person we support a voice in advance and then allows that person to prep and work through their goals, talk about their progress, their likes, their dislikes. So that gets kind of sent through our team to review. And then 3 to 5 days prior to the meeting, that gets sent out to the entire PCP team as a draft to review. The SIP, the DSA tool, any required documentation goes out in advance. So we got excited as we were building this, and we said, oh, when we have an annual meeting, this is great. Everything's there ahead of time. And the person, one, has time to prep, and the voice is the forefront for that meeting. So what we've done with now the prep meetings being built in a lot is we just talk with our team and we say, hey, this is the process we've been doing. We all really like this process. We can have a prep. We can maybe we only need the one meeting, and the team and the families have really decided how are we going to move forward with the annual. And it's working really well with many of our CCS partners. And again, the only other thing I really want to add is stress is the communication, because I think the fact of the amount of communication, and I have 2 team members who are pretty dedicated and focused on that almost daily communication with our PCP teams, the family, and the CCSs. That really makes a difference, having dedicated staff that is part of and fully their job.
I was going to ask a follow-up question to Regions, and then did you want to take on the pre-planning process? Okay. So Regions, 2 regional directors. Sometimes there's frustration around clarification requests, right? Yeah. So why? Why do we send things back for clarification? What's the purpose of that? And then what's the expectation in your regions on how to help facilitate resolution and completion of those clarification requests?
So there are times when our plan reviewers are reviewing the person-centered plans, and the plan is demonstrating a lack of clarity around our regulations and our policies. So that will trigger a clarification request. So we will send the plan back to the coordinator to clarify services, service needs, to obtain justification for service-related requests. And it has been effective in a lot of ways. At our office, we are working with our coordinators to make sure that they're completely clear around regulation policies. We're constantly sharing information. We are meeting with teams when needed in order to clarify service-related requests. We are utilizing our provider services team, our CCS squad team, again, just to reach out to just make sure everyone is on one accord as it pertains to those clarifications.
Thanks. And Kathy, same question, but I also want you to address, I know when we were kind of doing our pre-panel meeting, deciding what color we were going to wear, you also talked a little bit about that there are frustrations sometimes with potential discrepancies around clarification between the regions. And how do you think, how are we working on that, and what are we doing to address that as a DDA so that there is consistency?
Okay, I want to add first one other thing to what Anesta said. Sometimes when we send out a clarification, it's because the HRST, the plan, and what the person sees as their good life don't match at all. So if, we read these plans very closely. I love the pictures of the person because then I really know who I'm reading about. But when their HRST says one thing, the PCP says something else, and what is important to them doesn't match, we will send that clarification back because it's about the person and not just about documents being put into a plan. So I don't want to lose that. We have begun to put many, I think, very good processes in place. I guess it's been about 6 months or more ago, we started meeting monthly with the leadership. And when I say we, the regional directors, the program plan team and the CCS leadership. And we have put some processes into place that simply talking and communicating better has really made the data. I mean, I'm sorry, we have to have data. We have to see how many plans are late, how many clarifications are going out. And simply by meeting with CCS leadership and them presenting data to us, this is how many plans we have in on time, this is what was late, but here's why. And this is what we're putting into place as a CCS agency. And wow, it's working. So we have seen in 6 months a lot of progress, many fewer plans that are being approved past the annual date. The other thing I'm finding is that CCSs feel very comfortable calling me. Before it was like, oh, should we? No, we can't talk to the regional director till we talk to like 15 people. And I'll get a call from a CCS simply because we do the biweekly all CCS meeting. They now know a face. They've heard my voice. And they'll pick up the phone and say, hey, I'm stuck on this plan. You sent me this clarification. Can you help me? And so I think that has really helped build collaboration. And I may be the one reaching out to the CCS and saying, you're trying to tell me something here and I don't know what you're trying to say. And many times they're trying to make it sound way over professional when a very simple statement is exactly what you need. This is what the person wants. This is how we're going to get to their outcome or the goal they want. And I feel like those venues plus our CCS lead is meeting with each CCS agency weekly, monthly, and then we're creating what we're calling concerns list. We might have somebody that is going to need a lot of services from a lot of different places, and we want to make sure we don't miss something for that person. So I really feel like those collaborations have become very, very strong. Another thing we found is I will get a list from most CCS agencies of maybe I'm waiting for documents from this provider to find out that we aren't reaching out to the correct person in the agency. There was turnover and we weren't aware. And that's a simple phone call. So I think we've done a lot more in terms of communication, talking. Hey, what's going on and what does this person want?
Thanks, Kathy.
So we've been talking a lot about person-centered planning, right? And some of the information you've been sharing kind of leads into pre-planning. I think some of what Stacy has shared. But let's open that up and talk a little bit more about pre-planning. What's the value of pre-planning? Who should be involved in pre-planning? And then lastly, if you could think of some really productive pre-planning strategies or meetings that you've had, what was about them that made them that productive? So pre-planning, the value of it, who should be included, and maybe some examples of some really productive meetings you've been involved in.
All right. The value of pre-planning. I don't know how to understate that because it's critical to just the success of the PCP, the person having their needs known, providers being authorized to provide service and being able to be reimbursed for their efforts. If there's no pre-planning, it's all reaction. And the reaction leads to mediocre services at best. And maybe you aren't even authorized to provide those services because stuff doesn't get in on time. You can't do the new PCP in LTSS without pre-planning. I mean, just plain and simple. I think the biggest loss too, if you don't pre-plan, the person is left to the wayside because you're going to be scrambling to get different paperwork in, dot your T's or dot your I's, cross your T's. One of the things that we've done for pre-planning, it actually starts throughout the year, very similar to CCS's, where we've built a framework for our services where each service ends with an evaluation of what went well, what didn't, what would they change, what do they like about what the services are providing, what more would they want to do, so that every time we touch a person, we're building more and more knowledge about their interests and likes. And then when it comes time for the PCP to be developed, which is 3 to 4 months before their annual date, what we do is very similar to what Stacy mentioned, in that we develop our own kind of prep form where we talk about the person's interest, what's working, what isn't in terms of our services, and some areas of interest that they want to accomplish over the next year. And that sets us up really well to support the person in working with their CCS and ourselves in shaping those outcomes that are so critical for them.
I can say from the CCS perspective, pre-planning is really our time to spend getting to know what the person would report on their happiness, their success with their services, with what they've accomplished that year, what have been some of their barriers and challenges, in a more personal way than in a group, which really sometimes can be challenging for people to have their voice heard. And that's, pre-planning is critical for us to be able to hear from their perspective. I will say, I think, every provider at this table has talked about their pre-planning processes, and while somewhat different, they all have such a huge benefit to the process overall. And so we talk about direct support staff and family members who are present and with the person every day, and getting to hear from them about the things that have gone on that we weren't aware of, right? So we get that picture. And I think, Kathy, you talked about being able to see the whole picture. And so the pre-planning processes that these providers have put in place have been really helpful in that collaboration and communication with the CCSs. I think the other thing is it's a proactive approach to the planning process. It gives us time, as Alan noted, sometimes a person's needs change or they want a service that maybe you're not providing, and it gives us the opportunity to talk to you about whether or not that's something you'll be able to do for them. And then we can explore other resources. And so that's really critical for us in the pre-planning process.
Tying all that together, there's a lot of work involved in the pre-planning, as you can see, and collaboration makes it that much more meaningful for everybody. I would say that the biggest importance of pre-planning is so that way everybody on the team can prepare for any changes for the new plan year. That requires extensive documentation in the PCP. We have to ensure that if services are ending, increasing, or being adjusted in some way, that's clear as to why in the plan. And it also helps the CCS prepare for any new or different referrals that could be completed for the person. If pre-planning is not being utilized, we tend to find out things that aren't working at the actual annual PCP meeting. That then requires providers to have to explain to the CCS how to reflect those services correctly for them in the plan. And it can cause plans to be submitted late because we have to make sure it's accurate. So I would say that the pre-planning meeting allows us to be prepared for changes or be prepared to really emphasize what's working so we can maintain that eligibility for that person.
I think the only thing I would really add to that is the pre-planning meeting is actually a time to find out what's working, what's not working, to use the life course tools. And it's a time to dream. So to remember that it's also reflecting forward or looking forward to what a person wants. And sometimes those meetings, when they actually have the annual meetings, can be somewhat dry based on kind of what's going on. So I think when I hear people talk about their pre-planning, they're actually more excited about that than they are about maybe the annual meeting.
Just to add, I think pre-planning starts with the moment that person's going to be receiving prior, like you've accepted this person into your program and they're going to soon be receiving services. And thinking about charting the life course at Core Foundations at Kennedy Krieger, we've developed an entire 2-hour prep meeting 6 months before someone is even starting services. So if you're a transitioning youth, you're having this meeting in January, February with us, but you might not be starting services till July and August. And we invite the entire PCP team, the CCS, and anybody that person so chooses. We have prep documentation. We have videos to kind of share about what is the person-centered planning process, what is charting the life course. And that helps in the development of preparing for that person to join services, likes, dislikes, what do they want to put into their day, and supports the development of a schedule. But I agree with Alan. It's a year-long process. We're tracking data on goals daily, right? In our daily service notes, we're ongoingly doing that. So we've connected and built a goal bank within our online database that has implementation strategies, frequency, what is the goal, and how are we collecting data? And on every service note, there should be a goal focused on daily. So we're connecting what we did in the pre-PCP to the PCP to the daily note, and it's all the same goal that gets, or goals. And then also the fun goals, like just wanting to focus on maybe looking for apartments or things that maybe are not always part of the PCP, some financial literacy pieces, additional goals. Those are also, and fitness, tracked as just kind of, these are extra things I want to work on outside of that PCP process. So
we've talked a lot about pre-planning, great strategies. We've talked about the importance of having the person there, their family, the direct support staff. Are there other people from the provider's perspective that need to be involved, maybe with people who have different assessed needs, maybe some medical concerns or behavioral challenges? Do you bring other people into the pre-planning process, and who are they? How do you do that? How do you make sure that you get that information from maybe some other professional assessments?
So when I'm going to take us back to the beginning, that prior to someone starting services, we invite, if the school team, if they were with another agency, we invite the other agency into the process. If someone has nursing and medical needs, we've also had one of our meetings, we've had aunts, uncles, siblings, as whoever that person wants to bring into that meeting, they can come to that meeting. And we want to seek as many individuals as possible to learn as much as that we can to ensure that we're going to provide meaningful services when that young adult starts in services. And then as far as our PCP meetings, we have social work, we have nursing, we have OTs, SLPs, in addition to our direct support professionals and coordinators. So our goal when we're scheduling these meetings is that our direct support professional can also join the meetings because they are working with that young adult pretty consistently. And I would go back to, if we're going to mention challenges a little bit, is scheduling that meeting. And, we look out 2, 3, 4 weeks in advance. And a lot of times we're getting requests to meet next week. But it's really hard to make sure our direct support professional and that person is there when their schedule is already developed for next week and they're already planning. So sometimes as a provider, we need a little more time to be able to get that meeting coordinated with all team members.
Can I ask you a follow-up question? And this is for Jamie too. I can answer it too. You had, a couple of months ago, you reached out to me, right? And as did many of you, about the pre-planning meeting and where it must be held. Does it have to be on the 90th day? Or what are the flexibilities around that? So I guess, Jamie, does it have to be in person and does it have to be on the 90th day?
No,
Okay.
it doesn't. And I think, I'm just going to take it simply back to the person. And I think, that's uncomfortable. I hear and I love how many people are present in the meetings. But it's also important for us to ask that person if that's okay with them and if they want everyone there. And if the answer is no, we have to be uncomfortable and have those conversations and figure out how to honor their request. So we can hold a meeting in a variety of places. One of my favorite meetings was at a Green Turtle. So, we can hold them anywhere a person wants us to, and anyone who they want to be present can be present. And so, sometimes that's virtually. Sometimes people are calling in. One of the things we've learned through the pandemic is how to make things work when not being able to be in person. I think the 90-day is really a marker. It's just a pacing indicator for us that this is where we are in the plan process, and just keeping in mind of that and when it's going to need to be submitted and what are the other pieces that we need to collaborate on if we're not having it at the 90-day mark.
I once was the case manager for someone and the mom rented out the Golden Corral banquet room every year for the PCP and pre-planning meetings.
I was just going to add that you know, as a provider, a lot of times we hear you have to do this now, or we're on this timeline. We have to have this meeting next week. And what we've kind of shaped within our programming is the language is more like, well, as a team, let's decide this. So we're not saying as the provider, no, we want to do it this way. And it doesn't become this back and forth. We've really tried to change our language to think we, collaborative team, and then saying, well, what does Johnny want to do? And almost everyone we support, if they're able to, have an email. So we try to put that person on the email, loop them into the conversation as well. So I think changing our dynamic of this is my role, this is your role as the CCS, and it's not about that part. It's about we as a team are deciding we're going to have our annual meeting. The prep work that's being done with Johnny is working really well for our process. The CCS maybe meets with the family. We love when we're not in those meetings sometimes because the CCS gets different information to bring to that team so that we can work on solutions and strategies and best support that young adult or adult as they continue with their meaningful life. So there's benefits to all of these. It's just working as a team to decide what's working best within that team. And our teams are all different. Self-directed is very different than the traditional model, how we interact with teams. And that's really the beauty of this process too.
Another solution in regards to getting all the voices at the team is because of the scheduling issue, sometimes the people we support want a lot of people at their meetings. And so trying to get that scheduled just doesn't work. But we ask the person, like, why is it important that Joe, your direct support professional, be there? He can't be there that day because he has another job. And they say, well, we want Joe to tell you this. So the case manager, our internal case managers, make sure they get the voice of everybody that person wants at their meeting if they can't be there.
To tie into that, I think it comes down to making sure we're not completely process-centered and not person-centered. There is an initiation in the LTSS system for the CCS to start their work with collaborating on the PCP, but it has to be specific to that team. I say that with a very bold underline, and that person. It is no secret that there is turnover in both parts of the field. We do oftentimes have CCSs that are new to that team. We encourage and require our CCSs to ask the provider, how have team meetings been going? What does your provider agency typically do with this participant? What do they tend to prefer? That way we're not coming in forcing anything, saying you need to do it our way or the highway. We really want to be a supportive member of the team, not an enforcer. And sometimes 90 days is what people on the team choose to meet. We do have meetings that far in advance, but there are some that actually have to get closer to that 30-day deadline. And that's okay, as long as we all know why that is and that it's justifiable to what that person needs, we make that happen.
I would just add to that too, that, a piece of it is making sure that you save time for the documents that are required and the entry into LTSS. When we're getting to a point where we're having meetings closer to that 30-day mark, things could go wrong, right? People are sick, people are not there. And so then we're eating into the time that DDA needs. And I think we just have to be mindful of that so that we get the plan in well before that 20-day mark and that it gets approved on time for the person.
Kathy, kind of on that, and then I want to wrap our conversation on this section because we have about 15 minutes left, and I know flexibilities may be a hot topic. But Kathy, why does the region need 20 days to review a PCP?
When you're doing a thorough review of the PCP, you need to make sure that the plan addresses what's important to that person. We need to make sure that if an individual needs a one-on-one, do we know why they need a one-on-one? Is it because there's medical needs? And if there are medical needs, are we addressing it all across? It's not just a simple checklist of this document's here, this document's here, this document's here. But if there's something that's important for that person, have we made sure that we've addressed it and that that person's health, welfare, and safety has been met? I know that sometimes it feels like we're being a little too picky, but I don't want somebody out there because we missed an important service that that person needed to either reach the outcomes they want or to make sure their health, welfare, and safety is met. And sometimes you can't just sit through and go through a plan in an hour. You might need to reach out to the CCS. You might need to reach out to the individual. You might reach out to the family, because just as Jamie said, this isn't a piece of paper. This is a piece of paper or papers that have a person on the other end of them. And we want to ensure that what is on that paper is going to meet what that person needs.
Thanks. So Alexa, I think you summed it up well in when you talk about and you underscored the team process. And I think, Sean, before we transition, I think you as a leader, you as a leader at your organization, a leader in this field, do you think that, how do we work through the very defined roles and responsibilities of the person-centered planning process, but still come out the other end as a functioning team? Like, how do we do that? Do you think that's possible? Do you think it's happening? Are there things we need to do to make sure that that's happening?
So clarify that. So the team meeting, CCS, DDA, provider?
Anyone on the team, anyone that the person wants on their team. So there's very defined roles and responsibilities that seem to maybe assume that we act in silos. But I think we all can attest that it's a team process, right? And it takes all of us working in concert together. And do you see that happening? Do you think there's some work more to do? When you see it happening, what does it look like?
So I do see it happening, and I see it not happening. I think we've all had that experience, right? So when it is happening, it's usually because people are communicating. We've all talked about the need to communicate and then understand the role and responsibility and some of the questions, like the clarification questions. When DDA pushes back on clarification, if they know their role and the provider knows their role and CCS knows their role, that can probably be pretty limited and we can get through it. It's when people are still learning and people aren't on the same page and, you know, teams are coming together and working together for the first time. That's when I think it's a little rocky. But of course, we can do this. I mean, I think just when I think about what, you know, the DDA has said today, what CCS has said today, what providers are saying, is this is really about the person we're supporting. And we're all mission driven in regards to that. So if we can keep that to our forefront, that's why we're here. And when we just work through the problems when they do happen, because they will happen. And that's when I, you know, make our calls and we sit down and try to figure it out. But yes, I believe we can get through this as we start to experience it more. And then there'll be models for when it's working, and then it'll also, some of the nonsense will stop.
Yeah, please do.
One of, I think is really important to highlight is, even though the pandemic, which was a very long 3 years, still in it a little bit, is there are so many silver linings that came out through our partnerships with each other, providers, DDA, doors, and also systems and practices that got put into place that I think has really improved the person-centered planning process. And a lot of that is the hard work of team at DDA. And I don't want that to not be discussed here because it has made a huge difference, and the CCSs as well, and our CCS partners, because many of these processes did not exist 3 years ago. We were often not meeting deadlines to get those PCPs in, and then plans were being extended. So I think we all really need to celebrate the work that we've all done together in the last 3 years and where we're going to be able to take this and work with each other, talk about our processes, talk about how we're communicating with all the partners. And we can't forget partners outside. People are receiving services from BHA, from doors, and how are we, I know you're going to get into blending and braiding and all of the pieces later, but how are we also incorporating those pieces into even the DDA person-centered planning process?
Thanks.
I didn't see him. I'm sorry. Okay. Sorry, Alan, I didn't see your hand up behind me. I just wanted to tie in about celebrating the relationship with DDA. As Kathy mentioned, every regional office has been meeting with CCS leadership on sometimes even a weekly basis. Those conversations have been critical to our improvement of training, keeping our supervisors most informed, and also decreasing the frequency of clarification requests. If we know why DDA or how they're reviewing the plans, we train our staff to understand that method as well. So we know it's not just having the HRST included. What does it say? Are all the risks clearly outlined in the plan? Does it all match? Does it all connect? That type of feedback and coaching from the DDA office has really led to astronomical improvements in our program.
Yeah, and I think just to add to that, I think the most critical piece is being really solution-based. I think we see things working well and we come across challenges, and sometimes that's, with relationships, with education and understanding of services or the delivery system. But I think too, the things we've talked about with data points and that communication are being able to talk and name what the barriers are. And those conversations lead to possible system enhancements, right? And extra guidance that is needed. What training do we all need? And do people supported and families need, right? Because we've talked a lot about the collaboration for the whole team, but sometimes what we're talking about is a foreign language to the people we support and their families. And so that's a big piece of education and guidance that's needed for them as well. And I think that, one of the things I just think we can't forget to mention is as providers have been transitioning into LTSS, by and large, that's been so successful. And that is a representation of when providers, CCSs, and DDA have collaborated to make that happen so that people's services aren't interrupted. And I think we have to take that as a learning lesson and figure out how we can build upon that and look at, the different barriers that we need to continue to enhance in this system.
Jamie's plugging the LTSS panel this afternoon.
Yeah, Jamie, I think Jamie summed it up perfectly. The common theme here was communication, solution-based. That's where we've had our greatest successes. A small approach that we've used that's been very successful is for communication. If there's a disagreement, pull in a third party. So everybody's learning, everybody has their unique perspectives. We're gonna see things from different perspectives, and that's okay. The worst thing to do is to butt heads and just try to struggle it through. The best thing to do is pull somebody else in to help work through it. And one of the things that we've done that have been so successful for working through disagreements is when we communicate, we're always, if it's with DDA, we're including the CCSs. If it's with CCSs, we're including DDA. And all it is to support open, transparent communication. And what we found with that is we're able to come to resolutions very quickly. Sometimes we're wrong, somebody else, maybe sometimes somebody else is wrong. Sometimes nobody's wrong. We're just trying to figure things out together. So that open communication, really, I think that is what we've heard is a common theme and really critical to making everything work for the person.
Thanks, Alan. And I think, just to build on that, Kathy talked a little bit about when there may be differences between regions. Pull the two regional directors in. Send them an email, right? Say, hey, here's what I'm hearing. Can we talk about this? We've been doing that. It's been successful, so I'd continue to do that. So I want to transition us to flexibilities for the last bit of our conversation. I think Rhonda and I are going to tag team this. She's going to kind of do the one-on-one, two-on-one, those kind of supports. And I'm going to talk a little bit general about flexibilities, and then we'll have some questions related to that. So as I mentioned earlier in the day, DDA has updated or is finalizing our update on the person-centered planning, development, and authorization. And interesting enough, based on the last conversation, we did put a definition in there for team. We defined what a team is, right? I think you heard up here what a team process should look like and what the expectations are of that. We've now defined that in our guidance. We also have just defined flexibility, right? Because I think, as you're going to hear with Karen and John later, that there's flexibility needed, expected, and sometimes required for people in meaningful day services. That doesn't mean that there isn't flexibility required for personal supports, for certain supports in residential, right? And I think I want us to make sure we clarify a couple of things about flexibility. So, you know, we've been talking about it last week at the MAX conference. For those that you were there, we've talked a little bit about it in the CCS meetings. And what do we mean when we say flexibility? So, Onesta, when we say PCP flexibilities and flexibilities, do we mean a max authorization on every DDA service in the waivers possible?
No.
Okay. Kathy, what do we mean when we are talking about flexibilities?
So we need to look at the person's outcomes, and I think the best way to do this is give an example. You have someone who is not interested in employment. For whatever reason, they're not interested in employment. It may be age, might be we're just not ready for it. And so the person has selected day hab and CDS. But there are some days that CDS might not be a good idea because it's 20 degrees out or it's 110 degrees out. So you build that flexibility to maybe sometimes it's a whole week of CDS, maybe another time it's a whole week of day hab. It's a blend between, because in the summertime or the spring, there might be many, many community activities you want to do and you never go to day hab at all. But as Onesta said, it's not looking at every meaningful day piece and doing 30 or 40 hours a week for every single one, because then you aren't looking at what the person wants or what the person needs. And if someone's seeking employment, we have the milestones. You want to get all of those in there. But what happens if there's a hiccup and the person doesn't get a job, or they do get a job and the job doesn't work out for them? You want to have a flexibility in there, so we're not looking at doing a revised plan like we had to used to do every time something changed. You're planning for what the person wants, and then what are the strategies if that doesn't work out. Or if it does work out and we're doing employment, do we have follow-along supports? What do we have to support that person?
So in our guidance, how we've kind of framed this is to use some of the life domains through the Charting the Life course. And we have a chart that's going to be in the guidance, and it'll show you it'll ask some prompting questions. And I think one of the things that I get to thinking about when I think about flexibility is it's very difficult to sit down at the beginning of a plan year, right, in your pre-planning at the Golden Corral or the Green Turtle, and to say, I know exactly what I'm going to need every day of the week for the next 365 days. And that won't change, right? I had tickets to go to a play last night, and I decided I didn't want to go, and I rearranged them to Saturday, right? If I would have made sure I had personal support staff on only Tuesdays and not on Saturdays, and then I didn't plan for that at the beginning of the year, I may not have enough hours then to have that support, right? And so what I want to encourage teams to do, and what we want to encourage teams to do, is use those life domains. Think about natural supports. Think about activities that a person engages in, right? Somebody may go to a sign language class or a club that they go to 5 hours a week, and they may be in residential, right? And in the residential home, you have your base hours and you have your flex hours, right? But maybe nobody else goes to sign language club. Nobody else wants to go to sign language club, and those hours are being utilized, right? That person may need some one-on-one support to be able to access that activity in the community. I think the other thing too is we want to take into consideration anticipated needs, right? We all know kind of our anticipated needs. If I got health issues, if I got predetermined community engagements, maybe I'm a member of a choir, right? Maybe I attend an advocacy group meeting, but there's going to be things that pop up in the year. just like there's things that pop up with all of us in the year. And so how do we incorporate that into the person-centered plan, right? So we're in personal supports, right? Our authorization says you can go up to 82 hours of personal supports. Does that mean every single person that has a PCP is going to go up to 82 hours for personal supports? No. But maybe the team determines that they're 25, 30 a week potentially. But to account for unanticipated needs, maybe you guys have a conversation that we want to make sure maybe we add an extra 10, right? Extra 15, right? Depending on what that person's doing, what they're engaged in, right? So, Jamie, Alexa, how do teams engage around that conversation related to flexibilities? What does that look like?
Well, I think it's partly what you said, right? It's just connecting the person-centered planning process to real life. And I think when you talk about anticipated needs, I think about if we're trying to support someone and really having meaningful connections in the community and they haven't yet identified those groups, we don't know what we need, but we know that they have a desire to participate in a community setting, in a group, in a club. They want to go back to school. So some of those things that we can anticipate saying, well, all right, so like if they were to apply to school and it's 2 days a week for 2 hours, what would we need to do that? I think too, we talk about people in residential and thinking about people who are supported by their families. And I think as many of us know, family dynamics change pretty quickly, right? Other people's jobs change, hours change, their commitments change. And what somebody might be doing now isn't something they can continue to do. And so as we're looking at all of our available resources and networks, how do we build that into a plan that allows us to pivot and be really agile to meet that person's needs? I will also say, I think we're going to do a really good job of trying to build that into the plan with recognition that there are things that we can't anticipate ever happening that may happen. Somebody's diagnosis might change, somebody's level of need might change, something life-altering happens to people on a daily basis across the world. So we can't always anticipate that. And I think the communication and the collaboration of the team, it goes back to that because we need to be really responsive and utilize the revision process and really communicate with the region that this is what's happened and this is what's changed and we need to add this or remove it from a plan. So I think, those are the conversations we're having at tables and we just need to continue to build on them.
Along with everything Jamie said, I think this is a good place to bring up how useful the monitoring and follow-up visits are with the CCS agencies. She's exactly right. There are things that could happen that we can't anticipate. And there are emergency situation processes that we follow when that happens. But what we can anticipate are maybe annual trips to grandma's house in Florida. Maybe I like to volunteer at this camp only 2 weeks out of the summer. By visiting this person quarterly, monitoring how their services are going, and also discussing what to expect in the next quarter can help the CCS understand how services should be reflected throughout the year. Someone does not need 30 hours of personal supports 52.143 weeks out of the year. They might have other things in mind. And I think that those quarterly and monitoring follow-up meetings are just a great way to make sure we're ahead of that and making sure the plan reflects that accurately.
So we've also talked about data and core foundations at Kennedy Krieger. We actually, each person in our program develops their own personalized schedule it's color coded. So we know when they're in CDS, when they're employment and job development, and then we total those hours. So we did that to kind of, support our staff in the model, the LTSS model, and how we're going to be doing billing and our service notes. And then we've also built that into our database when we're identifying what services were provided. But that information supports in that PCP process to say, okay, you on average used 12 hours of CDS, and then you obtained a job that year. So you had, ongoing supports in the beginning, and now you're on follow along. And in some of our regions where we provide services, we have individuals, I'm going to talk about a specific group, a group of 4 individuals. 3 out of the 4 are in paid employment. All 4 have volunteering throughout the week, and then they also have CDS activities. When they're at their paid employment, they are sometimes on their own, sometimes we have staff checking in, and they're not always in CDS every day. So there's always a CDS option that they are able to come and join, and you're going to get way into blending and braiding later. But I think it's important to think about everyone has their own personal life, but all of this can happen within a year. And Nick said to me early on when I was kind of like, all right, we're having right now challenges in can we put job development, ongoing, follow on? If I don't know if you guys remember very early on, everyone's like, can we put this all on the same plan? See some head shakes, right? That was happening. And Nick goes, well, what does the person say they're going to need possibly throughout that year to help them achieve their goals? Because we are thinking about a year. And I said, oh, well, they have to obtain the job, they need support on the job, and then hopefully they're going to be more independent at the job. And that was how we started building our plans years ago. And then those who wanted to continue with CDS, blending that in, or vice versa. Someone is heavy on the CDS, considering employment, and then we build it the reverse way. But those schedules, that data, and being able to track within our database of how many, the different hours, the different services, makes a huge difference to be able to support those ongoing hourly needs.
So as we're talking about service flexibilities and we're talking about charting the life course and the integrated STAR, right, and having these great flexibilities, what planning, what considerations do you use when you're thinking about the integrated STARs, building relationships, building more community opportunities and connections so that we have a full life and maybe not just a service life?
So one thing I'll just add is Core Foundations, we serve within 7 counties in central and southern region, and we stay within 20 to 30 minutes of an individual's home. So we do a lot of, with the individual we support, community surveying. So being able to see what's in your community, what's around you, building relationships with your community. So that's one of our key focus, and then building community within our community. So we might have young adults in Howard County, Baltimore County. They developed they decided they wanted to go to United Way, and they made up their own volunteer program that they developed around Thanksgiving, or everyone wants to hop on the metro and go to DC. They plan these activities together to get out of their community and connect as well.
Sorry, I just didn't want to reach in front of you.
One of the things we do is when we're working with a person, services come in last. So when you think about the structure of a PCP and the outcome description, the goals really are the milestones or benchmarks to reach that outcome. And then there's the implementation strategy. So what we do is, what we highlight is for the outcome and for the goals is looking at all the different aspects of a person's life. And that's where the integrated STAR comes in, of all those different areas, relationships, finances, employment, all of those, which of those are needed to support them to reach that outcome, to reach those goals. And that turns into the implementation strategy. And then from there, and only then, is where services come in, because there might be something a family member can help out with, or there might be some type of support in the community that can assist. Services come in at the tail end, and we found a lot of success in that, where services aren't driving what happens with a person, what's done. It always should come in at the very tail end. So it's outcome descriptions, goals, integrated STAR, and then services fit in wherever they can support the person.
So we are near the end, and I want to just kind of highlight the slide that is up on the screen, because I think I created that before we had this conversation, obviously. But you touched on all those, right? Every single one of you mentioned something that's up on that screen. That in the person-centered planning process, the person's in the driver's seat, right? I don't think anyone disputes that. That to make this work, there has to be teamwork, right? And sometimes it gets messy and sometimes it gets frustrating. But I think you have examples from all of these leaders on how they've worked through those things. Communication is key. That's often how they're working through it, right? Sometimes an email just doesn't do it. You got to pick up the phone. You got to call somebody. You got to be face to face, at least digitally. You got to work together. And then from, I think, an overall process, we are a person-driven system. We have to be flexible, right? And that's all of us. We all, the regions, DDA, providers, CCS, we all have to start thinking about those flexibilities. And when we release our PCP development and authorization guidance, I think you're going to see a lot in there about flexibilities and how to have those conversations, how to think about it. This isn't going to be the only conversation we're having on person-centered planning processes. As I've mentioned and Bernie's mentioned, we are working with UMKC, and we are looking at the recommendations made by UMKC and NASDs to really take a deep dive into our person-centered planning process. And every single one of you are going to have to be involved in that process as we enhance our system. So thank you so much to every single one of you. You have been amazing. You did fantastic facilitating this conversation. And I'm just happy to be able to work with each of you every single day. So thank you. So we have a 15-minute break. You can get some more food. You can use the restroom. The second break of the day will have cookies, but right now you still have to eat some of the breakfast. And then we'll get started with Karen Lee and John Butterworth.